Next presenter is Ms. Keisha Sprott. I'm proud to introduce to you my team member, everyday partner at work. Ms. Keisha J. Sprott holds a Master's of Arts in Community Health Education from Brooklyn College. Ms. Sprott is a Maternal Care Coordinator with the Maternal Home program, the Mayor's initiative to address maternal morbidity and mortality in Black and Brown women within the network or health system, H+H. She has extensive experience in providing social service and health education to support vulnerable populations, including clinically high-risk pregnancies, people living with HIV, and people living with complex chronic illness. Her daily role allows her to address social determinants of health for families of Central Brooklyn, New York. Thus, she helps to improve the care one family at a time. Ms. Sprott, it's indeed my pleasure to introduce you today.
Thank you so much, Vashti. Good evening, everyone. How is the sound on my end?
Oh, you're great.
Great. All right, I'm going to share my screen. Can everyone see that?
Yes, we can.
Okay, I'm going to go ahead and get started. Today, I will be discussing the social determinants of health. Thank you to all organizations present for having me today. And I will just jump right in. So what are the social determinants of health? SDOH, they are the conditions in where the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So Healthy People 2030 is an organization under the US Department of Health and Human Services, and they have identified what are the most important social determinants in America that they want to track and improve conditions for Americans. So these are the 5 ones, and I will go deeper into each one of them. Education, access, and quality. So one of the social determinants that they've identified as being the most important is education. They want to improve early childhood education and development, enrollment in higher education, high school graduation rates, and overall language and literacy in the population. People with higher levels of education are more likely to be healthier and live longer. Addressing the nation's disparities in education and improving early childhood education, literacy, graduation rates, and college enrollment will directly improve health status with the disadvantaged. Some examples of health equity in education are universal pre-K programs, high school equivalency programs, and adult literacy classes. All of these aim to achieve more equity in health in education, ultimately leading to better health outcomes. The next one is economic stability. The goal is to help people earn steady incomes that would allow them to meet their health needs. So some of the key factors they are looking at include poverty, employment, food security, and housing stability. So there is a clear connection between financial resources, which include income, cost of living, socioeconomic status, and health. In the US, 1 in 10 people live in poverty, and many more are unable to afford healthy food, healthcare, and housing. People with steady employment are less likely to live in poverty, more likely to be healthy. However, many people with steady work still cannot afford to earn the things that they need to stay healthy, particularly in these inflation times. Some examples of health equity via economics are employment programs, career counseling, child care subsidies and discounts, SNAP and WIC. Those are food availability programs, affordable housing, and subsidies for those who cannot afford affordable housing, and affordable education as well. All right, so a major social determinant is healthcare access and quality. And the goal is to increase access to comprehensive and high quality healthcare services. 1 in 10 people in the US don't have health insurance. Without insurance, people are way less likely to have a primary care provider or just even afford the services and medications they may need. People are unable to get recommended healthcare services such as cancer screenings. Other barriers include far distance from healthcare providers. So if you live in a rural area, many Americans live in rural areas that are far from healthcare providers. So it's hard to get a primary doctor, let alone a specialist to address specific needs. Another healthcare access barrier is communication. So inability of doctors to accurately communicate with the patients that they're seeing and the community that they are supposed to be connecting with, and low quality of care. Some ways in which to achieve health equity via healthcare access are increased population of adults who get screened for lung cancer, breast cancer, and other types of cancer. So getting those screenings done earlier and to more people. Having policies to increase insurance rate coverage. So it's one thing to have insurance, but is the insurance effective? Is it covering your medications? Is it covering all of the treatments you're needing? The Affordable Care Act has made many great strides in improving access to healthcare. So far more people in America are covered by insurance at this time, and it has ensured that primary care services are fully covered, screenings are fully covered, which are essential, to improving outcomes, particularly for cancer early on. Neighborhood and built environment. So the goal for this social determinant is to create neighborhoods and environments that do promote health and safety. Many people in the US actually reside in areas with high rates of violence, unsafe air or water, and other health and safety risks. Racial and ethnic minorities, as well as people with low income, tend to more likely live in places with these risks, unfortunately. Health equity, so examples of achieving health equity via neighborhood health are reducing amount of toxic pollutants according to where you're living, increasing access to safe drinking water, putting fluoride in water, reducing lead levels in children, and reducing exposure to secondhand smoke. So one of the major social determinants that I don't think many people do think about or consider is the importance of social and community context. The goal for this social determinant is to increase social and community support. Having a connection and interactions with family, friends, co-workers, and community members is crucial to people's health and well-being. Positive relationships at home, work, and in the community can help reduce the negative impacts of challenges that people cannot control, such as dangerous neighborhoods, discrimination, inability to afford the things they need. So that means that although all of those other social determinants may exist for people, they may live in a bad neighborhood, they may live in poverty, having positive relationships, having that support can make a major impact. Many people don't have the social supports from loved ones to offset the negative impacts and are often left in the margins. So some examples of interventions in this area of social and community context, what can that look like? That can look like support for adolescents in foster care. Children in foster care are a major group that are left out of the discussion when they talk about health risks and risk factors, groups that are marginalized. They tend to have worse health outcomes compared to other adolescents. Increasing positive communication within families and parental support from early. Reducing bullying and providing supportive programs for marginalized groups such as LGBTQ. LGBTQ groups are another group that experience worse health outcomes compared to their cohorts at this time and are really in need of support of their families and community. All right, so putting social determinants of health into action. What can we do about these things? Because all of these things sound like, things that people are dealing with, things you can't do too much about. What can we do? So working towards health equity is the goal. Health equity is the opportunity for everyone to reach their full health potential, regardless of their environment, regardless of the social determinants. Health equity, it can be achieved by eliminating differences in exposures to contaminants and reducing disparities to exposures that certain groups are most likely to experience. So that is an example of larger scale intervention that can be implemented to help health equity, particularly for lung cancer and cancer exposures. However, as a healthcare provider, on a day-to-day basis, you can make a difference. So when interacting with your patient or community members, make sure to get the full picture. That looks like asking questions that can paint a full story of what is going on in that individual's environment and why. Begin by addressing individual behaviors with direct service interventions. So Healthy People 2020 have identified these 10 or 8 essential public health services, and I will quickly go through them. So how can public health address health inequities? Start with monitoring health status in order to identify and solve community health problems. So what are the health problems in your community surrounding you? Diagnose and investigate health problems and health hazards in this community. Inform, educate, and empower the people of those communities about those particular health issues. Mobilize community partnerships and action to identify and solve health problems. I can't emphasize enough the importance of community partnerships. Those smaller organizations really make all of the difference in reaching the community members and providing resources to them. Develop policies and plans that can support individual and community health efforts. Enforce laws and regulations that protect and ensure safety. Link people to needed personal health services and ensure the provision of healthcare when otherwise unavailable. Assure a competent public and personal healthcare workforce. And I think that is another important one that should be discussed more, making sure that staff, providers at all levels are trained regularly, updated in training on, cultural competency. Cultural competency is, acknowledging that the patient in front of you may come from a different culture, they may have different beliefs, that may affect their health. Being able to work and be flexible with that. Having training in personal bias and implicit bias is important for all providers to address and look deeper into what sort of biases are they working with when they're looking at a patient in front of them. So at Kings County, I'm just going to go through how we address some of these things. As a public hospital, we are able to reach many community members who are otherwise left out. So we are able to provide services to these marginalized communities that are dealing with many different social determinants affecting their health. Many of our patients don't have health insurance. So due to income, we see many with, immigration and asylum statuses that don't allow them to have health insurance. But at Kings County and at the other health and hospital facilities, they are able to get the care they need. We screen patients for food and housing insecurity, educational needs, childcare needs, and other factors related to social determinants of health. We have staff on site to directly refer to the resources needed to reduce stressors for our patients, such as SNAP and food navigators, WIC registration, health insurance navigators, and all resources are provided at all 11 sites at health and hospitals. So we outreach to the community, we screen for needs, and we address the stressors. We provide education on health risk in a way that can be understood by our community. We work in Central Brooklyn. We work with a lot of Caribbean Americans and Caribbeans. We work with a lot of immigrants. We work with people who speak all types of languages. So really making sure that they are understanding their health risks, reaching them and meeting them where they're at, and using all resources in order to, provide clear healthcare information. All right, so educating on health risks in a way that can be understood and received. These are important steps to address cancer risk and treatment in marginalized communities. So at King's, we do screenings. So screenings to know what are the social determinants that our patients are dealing with. So this is an example of the social determinant questionnaire that every single nurse at Kings County does with all patients. For my program, I work with a more specific population. So we do have a longer and more in-depth screening. However, this is a screening that everyone can receive at Kings County. So everyone is asked these questions leading to health equity. So these are what the questions are. I want help with health insurance, medical bills, and medical costs. I want help with public assistance, SSI or SSD. These are government programs to assist with employment. Within the past 12 months, I've worried whether my food would run out before I had money to buy more. This is called food insecurity. I want free and confidential help from a lawyer about immigration or other legal problems. I want help with problems with mold, pests, lead, water, electricity, or gas in my home. I am worried about losing my housing in the next 2 months. I sleep outside or in places like the subway. I want help with school, learning English, or job training for myself. I want help with daycare for my child. So these are all the barriers that may be facing our patients on a day-to-day basis. And you would never know that if all you're asking is, how are you feeling today? All you're doing is checking their blood pressure, checking their vitals and sending them home. You do have to dig a little bit deeper with your patients to know what is really going on and what can have an effect on their health. If someone is worried about where their next meal is coming from, if someone is sleeping in the streets, if someone is worried about paying rent for the next month, they are not going to take the insulin. They're not going to go for that screening their primary care doctor suggested 3 months ago. They are not going to follow up with their health needs because survival is their primary worry at this time. Okay. So we're just going to go into a little bit of a scenario and discuss. This is a scenario I put together with Vashti based on, some of the cases that we see on an everyday basis. And it may sound extreme to some, however, these are real life things that people are dealing with. And we put it together based on some of our most needy patients. So imagine a 65-year-old Black female who has worked 2 jobs as a bartender and subway cleaner to support her family. And this woman has lived in a pre-war building, which was constantly being remodeled. Both she and her husband have smoked cigarettes for more than 20 years. She has had to retire early to care for her grandchildren after the unfortunate loss of her daughter to asthma and son to gun violence. So this patient presents for care after feeling sick. Of course, they rule out COVID infection. She has a long hospital stay, presented with multiple issues compounding. And of course, that has also affected the well-being of her entire family. Eventually, she is diagnosed with lung cancer. All right, so this is the case, and I'm just going to go through how we would react to it. So what are the social determinants affecting this patient's health outcome? So risk factors. This patient is dealing with financial insecurity, food insecurity, neighborhood safety, environmental risk factors, mental health care, social support, healthcare access and quality. So these are some of the social determinants that I've identified based on that story. And what our response to this would be to provide a referral to government economic aid, such as SNAP and cash assistance, because she is retired. She had 2 part-time jobs, and she is caring for her grandchildren. Refer to therapy and support groups. As mentioned before, social support is a major and important social determinant of health that can really affect her health. She's dealing with raising her grandchildren, the loss of her children, grief, as well, dealing with the environmental and neighborhood violence that she's been dealing with in her family. Ensuring that this patient has access to insurance and is informed about her treatment needs and follow-up. So she does have a lung cancer diagnosis. She will need, intense treatment and follow up to know what stage she's at, what is her outlook, and what does she need in terms of her medical care. So having having a health insurance that can cover all of these needs is essential at this time. I would also assign her a medical care coordinator to help navigate the healthcare system. So they do have medical care coordinators under many insurance companies or assigned by the hospital that can really assist with reminding of appointments, escorting to appointments, home visits, discussing medication adherence, and things of that sort. So with someone dealing with lung cancer, I definitely believe having that partner that can to navigate you every step of the way would be essential. And lastly, I would refer to the Department of Health for a home assessment program for asthma triggers. So I thought about this because she is raising her grandchildren in the same home that her daughter was raised in. So they're dealing with the same environmental risk factors and they have the same genetics. So they are likely to develop asthma or maybe dealing with asthma already. So that's something you want to take care of early on so as not to repeat those same mistakes. And that is really the end of my presentation. Thank you.